And again, another good Thursday where we will be talking about our health. This is how we do it every Thursday. It's a day that has been set aside by IKD 106.1 FM as well as General Hospital Ikorodu to ensure that the general public stays aware and updated on matters that concerns our health. Now, it's one thing to live a healthy life. It's another thing for you to live a good life and a good health attached to this. And another end, we have some of these people that just live a life without a healthy aging. So today on the issues, we will be talking about something that concerns, the older generation and how well you can live a aging life. Right. So I welcome you this morning to the issues where we will be talking about healthy aging. Right. This is also in line with the World Physiotherapy Day that has been set aside every single year. 8th of September every year has been set aside to be a time where we take into cognizance the World Physiotherapy Day. What is this day all about? What does this day entail? Why should we take into cognizance a healthy aging? And like I said during the start of this conversation, it's a thing to age. It's another thing to age healthy, right? And to put us through that conversation this morning on the issues, we have two physiotherapists from General Hospital Ikorodu who will be talking to us as regards healthy aging and what exactly the day, World PT Day, stands for. So today on the show, when you hear me say PT, be aware that we are talking about a physiotherapy day that has been set aside to come up every 8th of September. For this year's edition, it happened on Monday, this past Monday, and the awareness was properly done. And that is why, again, we have our physiotherapist in the studio this morning to talk to us as regard the World Physiotherapy Day. And the topic that we'll be talking about this morning would also be into focus. My name is Opeyemi Ade Bambo. I'll be your anchor for this morning. With me in the studio, I have a physiotherapist, Ade Soya, in person of PT for Lajimi. He's a friend of the house. He has been here before now. Again, he will be talking to us this morning as regards the importance of the World Physiotherapy Day, as well as a physiotherapist, Alimat, who is also well seated side by side with our physiotherapist for Lajimi. This conversation will be a roundtable conversation where you would learn, I would learn, we all together would learn. So draw closer to your radio from now up until 12 p.m. while we educate ourselves on this day called the World Physiotherapy Day. Every year, 8th of September. Why do we have to take into cognizance physiotherapy? According to this World Health Organization and the talks around this is one day that we should always take very, very seriously. We go on this very, very short breather. When we return, we get talking to physiotherapist Alimat as well as physiotherapist Fola Jimmy. Stay with us. We'll be right back. Welcome back and thank you for still staying tuned. Don't forget the studio lines are always available where we would accommodate your text messages as well as WhatsApp messages. That will be on 0904 082 1061. 0904 082 1061. And you can call us directly to talk to our physiotherapist in the studio. Now, I will give out this expo free of charge for those of you who would want to ask questions, especially for those of us that are already aging, right? If you're already aging, I'm still a youth, I'm still a very, very young man, right? Those of us that are already aging and we have questions to ask in line with physiotherapy and to ask our physiotherapist, our medical practitioners in the studio, you can call us on 0904 081 1061. The studio line again is 0904 081 1061 or 0904 082 1061. I would want to say good morning and thank you for joining us this morning, physiotherapist Fola Jimmy. Good morning, sir.
Still young, good morning.
It's good to have you in the studio this morning. Good morning, sir.
Thank you.
Thank you very much for joining us. Let me properly say I joined the rest of the world to celebrate the World Physiotherapy Day. I celebrate you, sir.
Thank you very much.
Yes, you are a physiotherapist, one that I know sure knows his onions well when you talk about being a physiotherapist. So I say well done for all you do as a physiotherapist. Thank you for joining us this morning.
Thank you.
We also have right beside you the physiotherapist Alimat. Good morning, ma. Thank you for joining us this morning. It's good to have you in the studio.
Yeah.
And let me also say well done to you too as well. You are a physiotherapist and you've been doing this over the years. Thank you for all you do as a physiotherapist.
Yes, thank you very much for having me.
So we want to talk about the World Physiotherapist Day. Let me start with you, PT Alimat. it's always an honor to give the ladies the mic and to give them
Ladies
the floor.
first, yes.
Before they come and say we are doing a joro now.
Just
So let's start
equality.
with yeah. So let's start with you. PT Alimat. When we hear Physiotherapy Day, celebrating the World Physiotherapy Day, we've had this last year and we're having it again and it will continue. So, what exactly does this day stand for? What does it mean to say we celebrate the World Physiotherapist Day?
All right. The World Physiotherapy Day is a day that is set aside, like you have rightly said, on the 8th of September every year. We celebrate all physiotherapists around the world. We celebrate the good works that we have been doing over the years. Physiotherapy is becoming very popular in Nigeria for various conditions that we manage. We help strengthen people, keeping people fit every day, making sure that people are able to move around within possible means that are available to them, either with a walking aid or without one, strengthening them enough to be able to move around. Basically, what physiotherapists do. We also manage a wide range of conditions. We're talking stroke, Parkinson's, when people have a fracture, different forms of injuries are being managed by physiotherapists, just so that these individuals are reintegrated into the society and they're able to move around as independently as possible. So that's what World Physiotherapy Day is about.
Thank you, PT Alimat. I like the fact that you said with or without these walking aids. So, physiotherapists, you do not just do with the walking aids. With or without it, you help people to stay fit and stay relevant amongst our society. I still want to stay with you a little bit because today we want to focus majorly on healthy aging. And like I said, it's a thing for you to age. It's another thing for you to age healthy, where I will be involving PT Folajini. But before then, let me still stay with you, Alimat. You have said this is what the day stands for. Now, let's break it down to a layman's term now. For those that are listening at home, what are some of the things you do? Can you put us through your duty, some of the things you do? Is this to say that, oh, you are the ones that tell people, oh, this is how you use the crutches? What exactly is your work like? Can you give us a picture of what your work looks like?
So physiotherapists basically inform and help people on different ways to keep fit and be relevant in the society, like you have mentioned, like be able to be integrated back into their workplaces or into the society as a whole. So they can come for fitness training. Physiotherapists can structure exercises to fit different individuals and achieve various exercise goals, be it losing weight or being able to have some more balance, walking better than before, or just being generally fit. Physiotherapists can structure different things or exercises for people to do in order to stay fit and be able to move around as much as possible. So we are under the umbrella term of medical rehabilitation.
Medical rehabilitation.
Yes.
Brilliant.
So we have physiotherapists, occupational therapists, and some other professions under medical rehabilitation with the major goal of reintegrating people back into the society or back into their way of life.
Having said that, when we are having these conversations, in between, we would also infuse some of these assumptions that people usually have. So how can you address these, Alimat, when people say the only time you need a physiotherapist is when you have health issues, or physiotherapists are only for people who have health conditions? How true is that statement? For healthy people, is this to say we don't need you?
Oh no, healthy people definitely need physiotherapists. For instance, the theme of this year is talking about healthy aging with a focus on frailty and fall. For us to age healthily, we have to have started doing something before we even fall sick or have any ailments that would require a physiotherapist. So how do physiotherapists come in to help people age healthily? We can do a lot of strength training exercises. For instance, you come and see a physiotherapist, we tell you how much strengthening you need in our gyms so as to be able to age healthily. Activities that keep your joints moving, activities that keep you active like all the time is what physiotherapists can do for you. So it's not just when you have a condition or when you are sick that you need a physiotherapist. So you don't need to fall before you know to prevent falls.
You don't need to fall before you know to prevent falls. I think I
yes.
like that quote. Let me come down to physiotherapist Folajimi. So there's an open check for those of you that are listening. Before our two physiotherapists will be leaving the studio today, you might need your pen and papers because we would have to really tax them to give us some of the things we should be doing, right, to stay fit and stay healthy in line with this year's theme as regards a healthy aging. Physiotherapist Fola Jimmy, as regards what your colleague has said, what else do you want to add to all of those points in line with the World Physiotherapist Day, in line with the importance of a physiotherapist? What more do you have to say to us?
Okay, thank you very much. Like my colleague rightly said, she said everything up. But what I'm going to add, like she rightly said, is that you don't need to wait until you age before you take your health into cognizance, right? And physiotherapy, we have a word, we have a particular word. We'll tell you need to move.
You need to move.
You need to keep moving. So we've done some awareness here and there, telling people what they need to do, how to maintain their health, how to keep fit, how to stay fit, and all of that. And I've found a lot of people telling me, Peter, this one, yeah. So in a place like Lagos, that we wake up by 3 o'clock, 4 o'clock, we are going to work.
Always on the road.
Yes, we are moving. I would say that is not exercise.
It counts as stress.
It's the body is going to interpret that as stress. Yes.
Why some people think walking
yes,
is
so
exercise.
that's what they think. We walk. Lagos is always moving, and we are also moving. No, that is not movement. That is stress. So when you are exercising under a controlled atmosphere, and then like my colleague rightly said, your exercise is also dosaged. Yes. So there are some exercises you can do for 10 minutes. There are some exercises you can do for 15 minutes. There are some exercises you can do for 30 minutes. There are some you can do for 1 hour. At that point, your body is going to interpret that as good. So you are not having any stress hormones spiking in your body.
Because that comes consciously.
Absolutely. So even if you work in a busy metropolis like Lagos, you can set aside maybe your weekends, early morning brisk walk when you are not stressed of going to work, taking a brisk walk, 20 minutes, 30 minutes, come back to the house, maybe Sunday evening, another brisk walk. In fact, let me tell you, brisk walking for elderlies is the lowest hanging fruit anybody can have as a source of exercise.
Wow.
You don't need to invest any expensive exercise bike or early morning brisk walk. 30 minutes, you are good. Your heart will move, your liver will move, your blood will move, and stuff like that. So that's what I'm going to add to what my colleague has said.
Thank you, PT Fola Jimmy, for that one. Let's come down to the major conversation. Having had that very brilliant introductory lineup for ourselves this morning. The theme for this year is healthy aging. That means if you're aging, you should be healthy.
Yeah.
Don't just age. Be healthy while you're aging. Help us understand this more. When we say healthy aging, for you being a physiotherapist, what does it entail? Some persons listening right now, it's a thing for you to say you're 60 years and you are not even able to move. You are unable to move. And another man who says he's still 60 and still playing football. True. I'll give an instance. Somebody like the former president of the Federal Republic of Nigeria. I envy that man a lot. I talk about Olusegun Obasanjo. This is a man that will jump from a stage down to the floor. This is a man that's
former governor.
Right? So you still see these people involve themselves in exercises.
Absolutely.
They still play football. That is healthy aging.
Yes.
Right. So can you tell us what is healthy aging all about? How can I say, I'm aging, but I'm healthy?
Right. All right, thank you very much.
Yes, sir.
So, physiotherapists, we have something that we call developmental milestones. Right from the time that you have a child, and that child comes into the world, the age has started counting. So, by the time by the time that child is 1 year, you expect that this child should have attained some particular physiologic functions. Right. Now, by the time that child gets to 10 years, you are expecting that this child should be able to do this and do that. Same thing applies to when you are getting to 25, 30, 45, 55, 60, and 70. So those are those milestones. Now, before you get to a particular age in your life, let me tell you something for free. You see, number one thing that you need to really take into cognizance is your diet.
Your diet.
Yeah. I see somebody over about 50, 60, and then this person is still taking
Heavy
burgers and chips, fries, and I'm like, you are digging your grave gradually, because by the time, you know, the way that your liver is going to metabolize that fat at 50, 55 is definitely not going to be the way that your body is going to metabolize it when you're around 18 years.
True. True.
So I'm trying to give people, you know, because people feel to exercise and to keep healthy is expensive. It is not. And that's why I'm trying to give people the lowest hanging fruit. Number one, brisk walking. Number two, for example, I don't reduce a bar for my diet. Do you understand? It's not that these foods are not good for you. But when it gets to a particular level in your developmental milestones, when the body digests it and can't finish digesting it, you know what the body does? It stores that fat.
Stores it.
It's going to store it in your body as fat. Do you understand? And these fats can clog up and clog your arteries, clog your heart, and then you start to have heart diseases. That's why you start to have stroke and stuff like that. So, you know, lowest hanging fruit, brisk walking in the morning, you know, do fruits, do veggies, eat healthy, cut out the fats, reduce the alcohol. Do you understand? Any layman should understand what I'm saying. You know, because we see people that come to us at this age and they're asking me, doctor, what drug can I use to make me stay healthy? All those vitamins in those medications are already in your food. You know, all those vitamins are already in your food. So if you can eat healthy, you will definitely stay away from the doctor. Trust me, in your old age.
Aha.
Yeah, so
thank you. Thank you,
Yeah.
PT Folajimi, for that one. Let me come down to you, Alimat. Still talking about healthy aging. A lot has been said by PT Folajimi. Do you have extras to add on?
Yes, I would like to start by saying that healthy aging means staying active, maintaining relationships, and doing what you value as you get older. Like he has rightly said, we have different milestones for different ages. So the idea of healthy aging is that you are doing the right things at the right time. I've realized that in a city as busy as Lagos, where people are actually not sleeping, they term Lagos the city where we're always awake or something. People tend to reach out for a lot of comfort foods. For instance, you're eating gala every time. Gala, you're buying carbonated drinks. Some people can drink 5 bottles of Coke in a day.
And no, let's not
without
promote brands. Let's
actually-
just do carbonated drinks. Let's not mention brands.
Carbonated drinks actually. So all of those things, we need to learn to be more cautious of the things that we take into our bodies. That's one part of it.
Okay.
And then making sure that we're as active as possible. So being active can be different for different ages. So for instance, the things that a young person would do in their adolescent age, like in terms of activities, they can be able to play a lot of soccer, run around and all of that. An elderly person might not be able to do that. But if we gradually grade all of those activities and make sure that even while someone is old, they're still doing as much as possible. For instance, in your 60s, you can do exercises safely within your house without it causing any harm or anything. Things as simple as sitting to standing. So for instance, you're just sitting down, you're standing up, you're sitting down, you're standing up. It's helping the joints, like for instance, the knee joint to move as much as possible. So in essence, what I'm trying to say is that there are a lot of movements to do even as we get older that might not be as rigorous as when you were younger, but they will still help you achieve the same results as when you were younger. So the idea is just to keep moving, keep doing the things that you love to do in a safe environment, and of course focusing on the things that you take into your body.
Let's talk about one of the commonest health issues adults deal with while aging, which is stroke. You know, so last year we had a report coverage, and then we came down to General Hospital Ikorodu, where I discovered that many, or should I say most of your clients as physiotherapists are stroke patients. We saw some persons that are currently battling with a partial stroke and all of that. What are the major causes of stroke? Because stroke is very common amongst persons that are aging. Why stroke and what causes stroke? Let me start with you, PT Folajimi.
All right, thank you very much.
Yes, sir.
So the first major cause of stroke is I can tell you high blood pressure.
High blood pressure.
Absolutely. So there is a baseline to measure it. So we have the one on top, which is supposed to be around 130. It shouldn't be more than 135. Then the one that is below, I don't want to use any medical jargons here. That one around 95, 90, thereabout. It shouldn't be lower than 60, 50. Now, when your blood pressure goes above
135.
absolutely, you see, there are some tiny vessels in the brain. So when that pressure is high, it's just like forcing a jet of water through a very tiny pipe. So when that pressure is high, that pipe can actually burst.
Busted.
So when blood forces through these vessels and there is a burst in that vessel, immediately blood starts to go into the brain, you are definitely going to have stroke. So stroke is when a part of the brain dies off. So you understand that. So if you have the right side of the right side of the brain controls the left side of the body. The left side of the brain controls the right side. So if you have someone or you see someone that is paralyzed on the left, that means that person has a right-sided stroke. If you have somebody that is paralyzed on the right, that means that person has a left-sided
stroke.
Absolutely. Now, another causative agent is, low blood pressure too can cause stroke.
Low blood pressure too.
Absolutely.
So it could be high, which is a problem.
Absolutely.
And it could be low, which is also a problem.
God bless you. So when it's high, that's when we call it hypertension.
Oh.
When it's low, that's when we call it hypotension. Now, this is how hypotension can cause stroke. When that blood pressure is too low, blood doesn't get to the brain. Because our brain functions, the fuel for the brain is the blood. Because the blood will carry glucose and what have you. Now, immediately this brain is not getting that absolute blood, that side shuts down. Under 6 minutes.
Under 6 minutes?
It's 6 minutes.
Wow.
Do you understand? So, if we're looking at people's lifestyle, you eat too much fat, you don't exercise, this can cause high blood pressure or even low blood pressure. Now, another very common thing, because for a while now we've also worked with elderlies, another very common thing that happens to elderlies that cause stroke is what we call senile dementia, or what you people call Alzheimer's disease. Now, the brain just starts to shrink
by itself.
And you know the reason why? Because the cells in the brain, they are losing their bulk. Now, anything that affects the function of the brain will definitely cause weakness. So that's why you see some elderly we call it, either they have a shuffling gait. So what shuffling gait means is they are walking slowly, but they are fast.
They think they are fast, but
exactly,
they are walking slowly.
Exactly. You know, so these are the most common things that cause, falls and frailty in elderlies.
Thank you for that one. Now, you're going to help us, like I told us earlier, you're going to help us to understand some of the things we should start doing, right? So that we can have a healthy aging, and some of the things we should stop doing so we can have a healthy aging. But before then, you can also call us if you have questions directly on our studio line 0904-081-1061 or 0904-082-1061, where we'll talk about healthy aging. Let's talk about your duty and your role. Now, I'll come to you, Mrs. Alima, right? Let's talk about healthy aging, and let's talk about physiotherapy. How particularly do we need a physiotherapist when we talk about the importance of healthy aging to older generations, right?
Okay, I would like to start by saying that we've talked a lot about how physiotherapists can come up with different exercises on how to help. There are exercises that can actually help people reduce their blood pressure. I would like to add that one of the other things that cause stroke could be high cholesterol levels. So it might not just be the hypertension that can cause a damage to a vessel in the brain, but if there are so much fatty tissues in the body, it can also be thrown to block a vessel in the brain. So we need to also watch our cholesterol.
So is this to say that, sorry to interject you there, is this to say that people with obesity, being obese, could, their tendencies of...
absolutely.
Wow. Yes. Wow. Because of the high cholesterol level. So all those fatty tissues can also be thrown to places that they are not needed in. So what to do? We have to be as active as possible, as I've been saying. every day we need about 30 to 45 minutes of exercise.
Every day?
Every day. Not rigorous exercises like
Okay.
that. You see different people just taking walks around different areas. Just so that they stay active. They know what they are doing. Because it's better for you to be moving than not to be moving at all. Like we have said earlier, look into your diet. Just make sure you're as active as possible. Move around as much as possible. Maybe see a physiotherapist. You can come to General Hospital Ikorodu to have like a consultation with us. We tell you the things to do safely within your environment and within your means. So you don't have to register like for a very expensive gym or something. There are just some basic things that you can do within your environments that can help you age elderly.
You said something earlier, Alimat, and I want you to emphasize on that again. So let's take a step backward. Where you said exercises also matters and it differs from one age to another. Can you make clarifications on that? And why do I say so is because I go to gyms. A lot of people out there go to gyms, and you see that the gym instructor is giving a particular instruction on what to do at a time. And when you look at the crowd or the persons that are, practicing that particular exercise, you see ages, different ages. Now, how do a man above 60 engage in an exercise that is meant for a man below that age? But then every other person getting themselves involved in that. Let's talk about exercises and the role they play with a particular age to another. I don't know if that is clear.
Yes,
Would
okay.
you attend to that first, and then
Yes, I would.
Folajimi also does say.
Okay, yeah, so for the example that you gave, being in a gym setting, we call that a class actually. So
Okay.
we have different classes in physiotherapy.
Good.
We can have ME class or stroke class for stroke patients. The exercises that we give them in that setting is different from the exercises we'll give people coming for back class. So for
Okay.
instance, say there is a 20 years old man and a 60 years old man in the gym. So we want these two people to squat. We can put a chair behind the 60 years old man and tell him to sit.
Because of
it's
his
a
age.
form of squatting, as opposed to the 20 years old that just goes down completely because his joint integrity is still like more preserved than the man that is 60 years old. So things like that. In essence, what I'm trying to say is for different ages, there can be various modifications that would be done to each of their exercises to make sure that we are still achieving the same goal. For instance, the goal of squatting as an exercise is to strengthen some muscles around the knee joints and around the gluteal region, the butt. So if someone is squatting and then an elderly man can sit on a chair and stand up repeatedly as a form of squatting. He can hold on to the burglary and squat, then go up. In that sense, he has some form of support. So he's doing his exercises as safely as possible. Because at the same time, we're trying to make sure this person doesn't fall. Because that's another thing that leads to a whole lot of other conditions, say fractures and all of that. So yes, just modifications to exercises would really help.
Any adults
different
from you,
ages.
PT Folajimi? Thank you.
Thank you, bro. Yeah, I'll add to what she has said. So, right from the age of 50, 55,
Okay.
your chances of having a hip fracture increases
Oh.
as an elderly. And I'll tell you for free, if you fracture your hip as an elderly in this economy, you go need relatives to contribute for you. I'm telling you, because
It's a lot.
implants are now very expensive. Now, I'm not even talking about the implants because I presently have about 1 or 2 patients with me that I'm managing for this particular case. In fact, one is already deceased. And you know what killed this patient was because, so we're managing this patient. This patient was bedridden. She was frail. We couldn't even support her on the leg. She developed bed sores. It's so hard to manage.
It always bring about another issue
the
to another.
complications are
Yes. It
just
doesn't
too much.
end at just having a fracture.
Do you understand? So it's a good platform for us to let people know that by the time you are getting above 40, 45, in fact, it's even worse for females because from that age, post-menopause, the bones become very, very soft. Do you understand? Any fall that an elderly has, the first place that they normally fracture is the hip joint.
The hip.
Yeah. And when that hip is fractured, you are going for an implant. There is no two ways about it. And that is in millions, I can tell you. So it's a good way for us to let people know that you cannot afford a fall at a particular age. Now, coming down to exercises that we use, just like my colleague rightly said,
Yes.
there are exercises tailored for each age. So when you come in, we assess you, we plan your exercise treatment plan, and then we even give you home exercise programs that you can do. There is also something that physiotherapy that we do. We call it ergonomic evaluations. That is, we come into your home, we assess the safety of your home. Your tiles, are they friction? Are they friction tiles? Your toilet seat, is it too high? Is it too low? You know, these are some of the things that we can come and do for you at a very, very affordable price.
Okay, we would also still get to ask. I know I've seen you not once, not twice. PT, for Jimmy, while you do your thing, you are always very energetic with your. Do we call them clients or customers now?
Clients.
Right. I know you're always very energetic with that. So I want us to get to that point where you will tell us how your operations work with General Hospital.
Right.
Some persons listening at this time would also want to come around sometime.
Absolutely.
But before then, still talking about falls and fallacy, which is very, very germane.
Yeah.
For you, PT Alimat, would there be any add-ups to falls and fallacy? Now, we are on that note of prevention. Like they say, prevention is better than cure. Now, we are talking about it's very expensive. Implants are very expensive. But we don't want to get to that level. How can we prevent falls and fallacy?
Okay, so I like what you started with, that prevention is actually better than falls. You know, when you see a physiotherapist and then we tell you you would need a walking frame, I've noticed that most people, I once managed a patient that was very worried about using a walking aid because of how people will perceive her. You shouldn't be worried about what people think. You should be worried about how much your safety,
your wellness,
and how much you're helping yourself. So when we tell you that you need a walking aid, please use a walking aid to be safe. So in order to prevent falls, we already know your level of balance after assessment. So when we say you need a walking stick, you need this, you need that, after a while, we would eventually remove all of those things. But at least for the initial safety, please listen to your doctor's advice. Prevention is better than cure. Always.
Yes, thank you. Still on that note, before we move down to the phone lines, and then we take in calls, and then we look at one or two messages from our WhatsApp platform, if any. Let's now talk about, or let's still go back again, maybe before we get to that point. Let's still talk about stroke, which is always very, very common. There are sayings around stroke that stroke can only be managed, it cannot be cured. You know, while we're talking about these things, it's also okay for us to look at some common assumptions. This assumption, how true? Or do we say this is just a fallacious statement? Stroke can only be managed, it cannot be cured. Who is going to go first?
I think Alima should go first. That's her unit.
because I know this is the peak of the conversation. And for me, I've heard that a lot of times. That stroke can only be managed, it cannot be cured.
How a neurophysiotherapist, I would like to add that that there are different specialties of physiotherapy.
Okay.
So from the neurophysiotherapy point of view, stroke, I wouldn't like to use the word cured or managed. They are for different diseases.
Okay, sorry, let me interject you
again.
Okay. Because I always put the listeners first on my list, right? You are a neuro physiotherapist. We have doctors that are medical doctors, and we have native doctors.
Yes.
They are doctors. So when you say you are a neuro,
they are not doctors. Native doctors are not doctors.
They are doctors in their name. They still carry doctors. Right. So what do you do when you say you are a neuro physiotherapist? Initially, those listening will just feel, oh, the Alimat will be hearing her voice is a physiotherapist. Now she's saying she's a neurophysiotherapist. Is she saying she's a native doctor? Or which kind of... Can you help us understand that one first?
So neurophysiotherapy basically means that I'm dealing with conditions that have to do with the brain.
The brain.
So neurological conditions. For instance, in the case of stroke, the brain is affected. So I deal with the presentations of stroke after the brain has been affected. In Parkinson's disease, the brain is affected. There's also cardiopulmonary physiotherapy, where we deal with the heart and lungs. So for instance, when someone has a breathing difficulty, or like chronic smokers, when they have breathing difficulties, we help them manage that. So there's geriatric physiotherapy, where we look at the elderly people above 60 years of age. There is community physiotherapy, where we go into different communities to educate them on how to stay fit and safe within their environments. There is orthopedic physiotherapy or sports physiotherapy, where we look at cases like arthritis, sports-related injuries with the footballers when they injure some of their various ligaments. So these are the basic areas of physiotherapy.
Yeah, so back to the question now of, now that we know that you deal with the brain, we can call you Ogbon Alimat, right? Because those that deal with the brain are so deep.
Sadiq, yeah.
Right. So now that we know that you are the brain, I don't know if you saw that cartoon sometimes ago, Pinky and the Brain.
Yeah.
So you are the brain.
Alright.
So it's okay for Lajimi to be the Pinky. Actually, he looks Pinky. Right. So tell us, how true is that statement? Stroke can only be managed, it cannot be cured.
Yes, like I was saying earlier, I wouldn't want to use the word cured or managed.
Okay.
Like for different
Don't
conditions.
butter it, Alima.
No,
Don't
I'm not.
butter it.
No,
Don't
I'm not
butter
going to
it.
butter it. I'll say it as it is.
Okay.
For different conditions, they peak at different levels.
Okay.
So what you expect from a younger stroke patient is not the same result you get in an older stroke patient. For instance, if a younger stroke patient comes and they are fully healed and they can move around as much as possible, they'll say they have been cured. But an elderly patient that has undergone the same treatment that we did for the younger patients and is still working with the stroke pattern would say that they have not been cured. So it is different for different people. That
Varies.
said, stroke can peak at different levels for different people, depending on how quickly it was managed and how much of physiotherapy they had, or how consistent they were with their physiotherapy exercises and physiotherapy checkups, basically. So yes, stroke can be managed and it can be cured for some people. You just have to attack it as fast as possible.
It only varies and depends on when,
Level
the
of-
age,
Yes, and how
attention.
quickly they started getting treatments.
On the 8th of September, happens to be Monday, PT Folajimi.
Yes.
What exactly did General Hospital, what exactly did your department do? You know, aside the fact that you're coming here today, which is also another form of awareness, it's an awareness campaign.
Yes.
What exactly went down? Can you give us a profiling of what exactly went down on that day, Monday, 8th of September 2025?
Okay, thank you very much. I head the community health department for my unit, and basically what we do is letting people know about physiotherapy. We left the general hospital at around, I think, 10:30, 11.
A.M.
Yeah. Aided by the ambulance, my team, our HOD, we had drummers around, and we did a walk right from the hospital all the way down to Ojogbe. So we passed through Itailewa and then busted out Ladiga.
Brilliant.
We had flyers printed out telling people to come to General Hospital Ikorodu car park to get their health checked for free. We had a very good support from our amiable MD, Dr. TK
Yes.
Azan.
I like to call him Prince.
He's such a wonderful soul.
True.
You know, so all the way down from Ladiga, all the way back to General Hospital. Singing, telling people about what physiotherapy does, the importance of September 8th and all of that. So yeah, that was what we did for Monday. Then I think the second day we had our Keep Fit program.
Great.
Yeah.
Great.
So in during this walk, we're also trying to let people know the program lined up for this week. Yes. Currently, as I'm talking, we are having a Keep Fit program also for the staff and whoever cares to come into the car park and just move your body, sweat.
When would that be?
Today,
As we are talking to you, it's going on
it's
right
going
now.
on
Great,
right now in the
great.
You
hospital.
understand?
Great.
So, come to General Hospital Ikorodu car park. We're having a Keep Fit program. It's absolutely free. You don't need to pay any kobo. They'll have your vitals checked, give you health advices for free. And you can now, when you come, we will also introduce you to some other things we can't even talk about on radio, because time is really fast spent.
Yes. So for those of you listening, if you have the time, find your way down to General Hospital Ikorodu, just opposite the local government, Ikorodu local government there. You can be a part of that fitness. Don't let it be a case of what we did way back in secondary school. Daddy, they say we'll pay for physio and we'll pay for therapy. So 2,500 for physio, 2,500 for therapy to make 5,000. It's totally free, no charges. So don't think it's something that you need to pay something at the gate. It's totally very, very free. Let's look at your working hours. This is also still part of the awareness and campaign. When are the doors opened, your department? When do you open your doors to attend to people when it has to do with related matters of a senior physiotherapist?
Alright, so here in General Hospital Ikorodu, we start as early as 8 a.m. and the department is open till 4 p.m. For now, physiotherapy is not a first contact profession in Nigeria. So first you have to go and see a doctor. They run a complete check on you to be sure that, okay, you are fit to come for physiotherapy. And then once we get that referral, you come to our department, we attend to you, we fix you in the units that you belong to based on what I have described. So for instance, if someone is coming and saying, oh, I have knee pains, you will not be in neurophysiotherapy because it's not your brain that is affected.
True.
So they're sent automatically to orthopedic physiotherapy and then their management begins from there. They have an initial consultation, and after the consultation, exercises are recommended for them. Apart from exercises, we do a lot of hands-on treatments for patients. It is not just massage. I feel like people have that misconception that for massage. No, physiotherapy is not just about massage. You come into our department, we assess you, we do some treatments and some manipulations for you inside the room before you come out for your exercises. So yes, we're open from 8 to 4 p.m. and then we also attend to patients on admission.
8 to 4 p.m. every day?
Every day.
Saturdays, Sundays?
Mondays to Friday.
So on Saturday, we come around for our call duties. That's what I was about to talk about.
Okay.
So it doesn't end by 4 for us.
Good.
We still attend to patients on admission. Good. So we have some stroke patients that were just initially admitted. We attend to them. People that have just undergone surgeries. People in the ICU, we attend to them in the ward. So they don't need to come to our department. So that said, you can... As long as you are alive, you need physiotherapy, and we would always be available to treat you.
I don't know if this is going to put you on the spot again, but if at all it would, we need answers. Many a times people don't tend to want to see a physiotherapist like yourselves because they believe there are alternatives. One of the major alternatives is the trado, which is the traditional ways. They will just tell you, Tawo labor. They will tell you, these ones will even do it better than hospital. We have had cases where they will tell you, don't let them attend to you when you get to the hospital. Just go and do traditional straight up because they feel that is even better. Some people will tell you, aside the fact that we believe traditional will do better, it is more affordable. Physiotherapists are very expensive. How do you help us deal with this? I believe this is another hot spot and we expect the truth and nothing but the truth.
I would love to take this question. Thank you very much, Theorion. So first off, we need to give a lot of kudos to the Lagos State government because for the first time, we have a Trado Medical Board set up by the Lagos State government to regulate these people now.
Great.
Yeah. So I'm telling you this because, so this falls under my unit, community health.
Okay.
So General Hospital took this a step further by engaging with these people. In fact, as a matter of fact, they have little training for these people. And you know the reason why? You can't do without these people because the people, the populace, like you rightly said, we prefer to go to them first. So the thing is this, let's educate these people. Let's let them know their jurisdiction, what they can do. If you get to this particular spot, in fact, matter of fact, we have turned them to a point of referral. That so as incentives, if you bring a patient to General Hospital, there is an incentive for you. So even the Trado right now, they have an incentive to bring the patients to the General Hospital.
So if at all people unconsciously, ignorantly goes there.
And I feel that was a very brilliant idea by the Lagos State government.
Great.
Because it was a menace. It was a menace. By the time these people get to you, they are coming with complications that you cannot even manage any longer.
When it has gotten bad.
But some even die in the process. You know, so yeah. So Trado, yes, they have their own thing, but it's good that we let them know that, hey, this is where your box stops.
There are measures.
Exactly. So you can't say because somebody has a femoral, a thigh fracture, and then you are splinting it. When that particular patient needs to have an intermedullary nail.
I know somebody who lost his entire leg because of
that is what it
traditional ways of treatment.
That patient was even lucky. If that patient develops sepsis, then the patient is gone. Because sepsis is another headache to manage in the hospital. So, you know, we let people know that there are some things that you can take to your Trado. And there are some things that, you know, it's not your Trado that's going to fix this thing. It's not every fracture that you can treat, that the Trado can treat. Yeah. So, yes, we need to give kudos to the Lagos Secretary.
Halimat, I know you also want to say something, but let me throw this to you before you say what you want to say. P.T. Folajimi has not answered me well enough, right? How expensive or affordable are you people? We hear that you people are expensive, so don't bother. Are you people expensive?
Halima, let me go first. Let me go first.
We hear you people are expensive.
Yes, let me go first.
And that's why people are not coming.
Let me go first. So, still young.
Yes, sir.
When people say we are expensive, I tell people that expensive is relative. Yes. Expensive is relative. So, if as a professional, I am treating you for XYZ amount, and I'm helping you prevent millions of future complication treatments, you can't call that expensive. So, you have a fracture, just like an analogy we made some few minutes ago, and then you take that to the traditional bone setters, and they mess up your leg. If you are lucky, you don't die in the process. I think a cow should be around $1 million or 2 million naira. That's expensive. I just treated you for about 10% of that to prevent you from spending on a burial or prevent you from having your leg taken off.
The cow that be needed for the burial.
I'll be there for the burial. So I tell people, expensive is relative. I think I'm able to answer your question still young.
Thank you. We have to leave the studio, but then let me come back to you and leave
I would like to start with the traditional bone setters situation. As contradictory as this may sound, the hospital is the best place to be. We attend to patients under the most safe environment. So these safety regulations to prevent infections are the things that these other people do not take into consideration. And that's why a person develops infection that is serious enough to lead them into amputating the leg. So please, whenever anything happens, don't be scared. Come to the hospital first. It will be handled appropriately without further complications. That's the number one priority, to prevent further complications or deformity, or to prevent how much loss the patient is going to incur. Moving on to physiotherapy being expensive. Health, they say, is wealth, right? I think it is wiser to spend on your health in order to prevent just elongating the matter. So spend now and rest later, so that you
I was hoping to hear a banking term. Spend now and receive later. Bank with us today.
And I want to appreciate the Lagos State government and the MD. You know, that's what the General Hospital is about. If you cannot afford to have a private physiotherapist, you can come to the General Hospital. Our treatment is subsidized to the barest minimum. I think, for instance, now they pay 30,000 for 10 treatment sessions. That means you come into the hospital, we see you for 3K for the first time. That's affordable, and we give you our best.
Just 3,000 naira.
Just 3,000 naira for the first session. But you have to pay for 10 sessions because we like to educate people that it is not magic. You have to keep coming consistently for you to see results. So when you keep coming around, you see the results that you want to see. So 30,000 divided by 10, 3,000, and we're good to go. I think that's fair enough.
All right, we have to leave the studio. I must sincerely say thank you so very much, Folajimi, as well as Halimat. I enjoyed every bit of this conversation, and I also learned. So what will be your parting words? Let me come down to you, P.T. Folajimi.
Move. You need to move.
Yeah.
And your physiotherapist will make you move. Thank you very much, Lagos.
Yes, PT.
Yeah, my
Halima.
parting word is going to be that prevention is better than cure. Don't fall and start looking for solutions. Prevent falls first before any other thing happens. So yes, always prevent the evil things from happening. Thank you.
Apologies to those of you that I could not take in your calls, but let me take this very, very one call before we leave. Hello to you, good morning. Thank you for calling us this morning.
Physiotherapy to call for this afternoon. In fact, I've been there before. And one of their patients, they are trying to, don't let me deceive you, they are trying for us. I really need that because this last year I've been suffering from back pain. Normally, I don't have any fracture, but I explained for them about my that back pain. But they placed me on some medication and this will do massage for me. And since then, in fact, body don't do better. So you are supposed to go to hospital that this month, September 1, but I did not go because I'm feeling better. I cannot like I'm supposed to go without the date, September 1. I did not go. Even I know one of those people that's talking, that woman, that lady. I know her very well. They are really, really trying for us. So I pray that Jehovah will bless them. I will give them strength to be helping us. So you are trying to. I give you kudos. I give kudos to you.
Yeah.
you.
Thank you very much. Thank you so very much. We will not be able to take in any more calls. Apologies for the calls. It was very, very important that we take in all the necessary details. This is how far we can have it today on the issues as we are focused on this awareness set aside by the World Health Organization called the World Physiotherapy Day every year, 8th of September, for you to stay safe. Health is wealth. Special thanks, of course, to the Prince, the medical director, Dr. Taiwo. He's a man I respect so much. Special thanks to your department. Special thanks to PT Folajimi. Special thanks to you too as well, PT Halima. I am Okoyemi at Debambo. Until next week, Thursday, same time, same station. God bless Nigeria. God bless Lagos. Remember to stay healthy.